As people in cities across the country join in the protests against police brutality, some health officials worry the mass gatherings could lead to a surge in coronavirus cases. They also warn the potential new infections may add to the already disproportionate impact the virus is having on minority groups. For more on this, let's bring in Star Tribune medical reporter Jeremy Olson. He has been following the outbreak in Minnesota. Jeremy, that is the first thought that I had as I watched the groups and the protests get larger and larger, spreading to all 50 states, that people were not only in risk of physical harm because of some of the police actions out there, but also they're in danger of getting infected with the coronavirus. And I wonder what that's going to look like in 2 weeks or in 3 weeks and 4 weeks down the line. What are you hearing from health officials?
Well, you could see some social distancing at the start of some of the protests. People were still listening to what health officials had said. They were staying in little clusters 6 feet apart. They were wearing masks. But then as tensions grew, a lot of that stuff went out the window, and people were just in mass gatherings and clusters. And health officials say it's going to be really tough to trace this outbreak in terms of where it's going, who is infecting who, and when the numbers start to increase, it's going to be harder to kind of put the clamps on it and to slow down the spread because of the clustered nature of these protests and how close people were as they potentially infected one another.
And one of the challenges throughout this whole pandemic, as I'm sure you've chronicled, is that it's difficult to get sort of a hard and fast rule from officials. Do this, don't do this. Whether you listen to the CDC or your local health department or some doctor you saw on TV, often there are different messages. I'm wondering if these protesters are getting any sort of official guidance on how to protest and be safe.
Yes, even our health officials were acknowledging that protests were going to happen, that it was a natural outgrowth of the rage and the anger over the death of George Floyd. They just told people to stick with the basics, which is, try and respect social distancing, wear a mask. There had been a lot of different questions over time about whether masks helped or not, but they are saying, look, wear a cloth mask, a non-medical grade mask, save the medical ones for the doctors and nurses who need them. And it was stick with the basics, but I think there was a recognition that the whole notion of people staying apart was going to be tough to maintain.
So as of now, where does Minnesota stand when it comes to the number of confirmed cases and deaths?
Our latest numbers put us over 1,000 deaths as of this weekend, more than 24,000 cases. And in Minnesota, the strategy has been around preventing our hospitals from being overwhelmed. I know our governor was focused on preventing what he saw in Italy, which was cases of people needing intensive care, needing ventilators and not having them. And so that's been a closely watched number. And we currently have about 550 people who are hospitalized and 250 in intensive care. And that's a closely watched number here as well.
In an article that you published last week, you said that Minnesota was listed as trending poorly on a COVID exit strategy website. That has changed. It's now listed as making progress. I'm wondering, what led to that change, and also, I guess, what's the prognosis moving forward now that we're dealing with a whole other set of issues?
Yeah, there did seem to be fairly good adherence to social distancing before all of the protests got started. The traffic numbers on our highways were down. Mobile phone tracking showed we were doing a decent job of staying separate and not making a lot of random trips away from home. But two things have happened, including a scaling back of social distancing and stay-at-home restrictions. Today, as a matter of fact, is the first day outdoor dining can resume in Minnesota and limited hair salons can reopen. But 2 weeks ago, more businesses were able to open, and we were already watching for an increase in cases that was going to follow that loosening of restrictions. Now, with the protests, in the next 2 weeks, I think they do expect whatever progress we just had might be out the window, and there might be a turnaround in cases. But of course, there's an incubation period. Once you're infected, it takes 5 days for symptoms to show up at the least. And so if there's any impact from what's going on right now, it's not going to show for another week or two.
Yeah, right, Jeremy, that to me is, Sorry, I was just going to say, Jeremy, that I think is probably the one question that I would have for you before we wrap this up. Have you heard from officials? I know that they've got their hands full in Minneapolis over all the protests, but have you heard from officials if there's any talk of pulling back on the reopening? Because the danger is not just for those folks that are out there protesting. The danger, of course, is they go back to some of their places of business or they go back to some of those jobs that have now reopened, and other people are in danger who have nothing to do with the protesting that's been happening.
Or, Vlad,
Yes,
they go
agreed.
back to the states that they came from.
Good point.
Both could very much
Exactly.
be true. Yeah, and our problem has been in long-term care facilities. So many old people have been and living in long-term care, nursing care, have died. But a lot of the workers in those places are lower-wage minority workers. Whether they were part of the protests, I don't know. But they could be friends of friends or relatives, and that could reintroduce the virus into high-risk places like that. So there's definitely, whether it's just the protesters who are generally younger and they might be able to weather it, they could reintroduce this virus back into high-risk places. And it should be noted that we have about 20% of our cases are among African Americans, and more than 20% of our cases are in hospitals are African Americans. They represent 6% of our population. So there is an elevated risk for the Black community in Minnesota as well.
Jeremy Olson, thank you so much for your reporting.
My pleasure. Thank you for having me.